New tonight, by the age of 50, about 85% of men experience some hair loss.
Traditional transplants involve painful surgery, but now that can be avoided with the help of a robot. CBS 2's Dr. Max Gomez shows us how hair transplants have gone high-tech.
I'm excited. I'm nervous, but excited.
Chris Lagrateria is about to undergo cutting-edge treatment to restore his thinning hair, and with it, some self-esteem.
You don't feel as young. You don't feel, I don't want to say the word macho, but macho comes to mind.
He'll be getting a high-tech procedure, the ARTAS Robot, an automated system that extracts the follicles from the back of the head to be transplanted to the balding area. He's up for the new approach.
And this just seems to be the next generation. It's an amazing technology.
Dr. Herbert Feinberg says typically follicles are taken from a donor strip of scalp that's cut out and then sutured closed to leave a telltale scar. Using ARTAS is less painful, has a shorter recovery time, and removes the hair more precisely.
This robot is very intuitive. It makes decisions on its own.
For instance, the robot measures the follicles to identify which hairs will be best to transplant. It can determine the strength of the hair and can tell the angle the hair is growing to avoid damage during follicle harvesting.
I hope to look like Elvis, but I doubt that's going to happen, but I can't wait.
I'm a little vain.
Richard Coca had his robotic transplant 2 years ago.
All of a sudden, one day you look in the mirror and go, wow, look at this. That's a pretty cool thing.
The back of Lagrateria's head is shaved. Instead of the long scar he has from a previous transplant, the robot maps and extracts the follicles in a random pattern of tiny punches, a better cosmetic result. After that, the surgeon implants the follicles in a natural pattern by hand. Lagrateria's hair should start growing in about 6 months, but it'll be a year before the full results are seen.
Absolutely painless. Yep. Didn't feel anything. And looking forward to seeing the results.
The robotic procedure costs considerably more than other hair transplants, and the procedure takes longer to do. And while donor site scars are more easily covered in women, the robot can also be used on females. Dr. Max Gomez, CBS 2 News.
The price of beauty, right?
Mm-hmm.